Hi, Sylvain from Mancuso Clinic, and this video is going to explain how you can reduce your back pain using three main pillars to help you in your everyday life. For a quick presentation, I'm Sylvain Mancuso, owner of Mancuso Clinic. I'm an osteopath, I'm a French physiotherapist and a life coach, and we here at Mancuso Clinic help people managing their chronic or acute pain. The approach of taking care of your back pain is for us a three-pillar approach. And this triad, that we call that like that, is going to be about three main things: nutrition, mindset, and physical health. Back pain is, in 2020, more than 600 million people were suffering from back pain. In 2050, they think that more than 850 million will suffer from back pain, and for few reasons. First, because the population is growing, the population is aging, and at the same time, our sedentary lifestyle is impacting our global health. We are going to begin to talk about the physical side of the back pain. For the physical health for back pain, it's a melting pot between strength and flexibility. When we talk about strength, we talk about core exercise, because have a strong core will reduce the risk of back pain. How you can improve your core muscle, it's with plank, bridge, side plank, many different exercise, dead bug. There is so many exercises that you can find to improve your core, because when your core is stronger, your back has less risk to move in the wrong way. But at the same time, it's not only about strength, it's about flexibility. And at Mancuso Clinic, we often see people with tight hamstring, quad, hip flexor, adductor, or psoas, hip flexor and psoas is the same, can increase the pressure on your lower back. It's why be able to stretch your muscle in the legs will reduce the tension in the lower back. Because if you look at the big picture, when you have a body like that, there, we can understand that if there is some tightness in the leg, is going to increase the pressure in your lower back. But at the same time, if you have some tightness in your upper back, is going to increase the pressure on your lower back. It's why be able to keep a good mobility in your upper back and in your leg is really important. At the same time, when we talk about strength, we need to think about the balance between the front and the back. Have really strong pectoral is going to change your posture, change your upper back, and can increase the risk of your lower back. Have the right exercise routine. You can ask your physio, chiropractor, massage therapist, or osteopath to give you the right exercise to do to reduce the risk of back pain. The other part of the physical health is about posture. Why posture? Because for us at Mancuso Clinic, posture is like the foundation of your house. If the posture is not straight, it's going to increase the risk of lower back pain. If we do, you can imagine that if your upper back is rounded, your lower back will need to compensate that, and you will have pain in your lower back because your upper back doesn't work. But when we talk about posture, we don't have a symptomatic approach, and we really try to find the root cause of a bad posture. And when we talk about root cause, sometimes some tightness in the leg, some issue in your feet or your hip area is going to change your upper back and change your posture and increase the risk of lower back issue. How you can manage physical pain at home. If it's an inflammation, often you are going to put ice. If it's a muscle tightness, you are going to put hot. But the first things to be sure is which type of issue you have, and be able to choose between hot or cold, and have the information come from your health professional will help you to do the right decision for your back pain. Because if you have inflammation, you are not going to put heat on it. And if it's muscle tightness, you are not going to put cold on it because it's going to increase the tightness in the muscle. The other part of this 3-pillar approach is the mindset. When we talk about mindset, we talk one about the stress, because your stress level with the mind-body connection is going to increase the risk of lower back pain. Studies show that people with more stress are often more prone to have lower back pain. At the same time, when we talk about mindset, we talk about everyday habits, because brain likes habit. And when you change your everyday habit and introduce more physical activity on a regular basis, it will improve your lower back and reduce the risk of injury. At the same time, we know that physical exercise is going to reduce your stress level, but everything starts from your everyday habits. And your everyday habits is completely related with your mindset. Have a professional who is going to help you to integrate new exercise in your everyday routine can make a huge difference. And on the last part, when we talk about this triad, we are going to talk about the nutrition side. On the nutrition side, we are more prone to talk about inflammation, because inflammation is going to increase the risk of back pain. And often inflammation is a precursor for other illness, about cancer or many other things. The idea of reducing the inflammation is going to reduce the intake of food, which is going to increase this inflammation. And which type of food can increase the risk of inflammation? We talk about sugar, processed food, and dairy product. Be able to do the right choice for your health will reduce the risk of inflammation in your body and help you to manage your back pain better. But at the same time, reducing the intake of inflammatory food is good, but what you can eat to reduce the inflammation in the body. You can take some omega-3, some fatty fish, or some nuts to help you to reduce the inflammation. You can take some avocado that are really rich in omega-3. You can take some not pills, but some sorry, my French is kicking in and I can. Okay, nutritional supplements. Sorry, my brain had an issue. Like vitamin D to help you to reduce the inflammation. The other part on the nutrition side is going to be the weight management, because the studies show that people with overweight are more risk or more prone to have lower back pain. At the same time, have more weight on the system is going to increase the risk on the disc, but at the same time will change your posture to compensate this weight. If we want to do a quick recap about how to take care of your lower back pain using the 3 pillars, do some exercise and stretching and core exercise on the physical health. Be careful about your nutrition to reduce the intake of inflammatory food, and increase the intake of anti-inflammatory food. And on the last part, on the mindset side, if I have one big advice to give you, is learn how to manage your stress, because stress is often increasing the pain, but at the same time is going to produce some bad hormone, will going to increase the inflammation in the body. Then reducing your stress level will help you to manage your lower back pain. If you have any question, you can just reach out to us at mancusoclinic.com. On the description below, We will give you access to a special ebook we did to help people with lower back pain on a 7-step, really efficient. And it's not only about lower back pain, it's about pain in general. And if you can reach out to us, you can contact us at info@mancusoclinic.com, and have a great day.